Our next speaker is Arabella Kyprianides from UCL, and she's going to be looking at why people may choose or not to, let's call it, cooperate in the fight against the pandemic in a more active sense. Over to you, Arabella.
Thanks for the introduction, Ben. So hi, everybody. Today I'm going to be talking to you about what happened in the early days of the lockdown as well. So I'll be taking you back to April this year to talk to you about how solidarity with the police promoted social control of the COVID-19 lockdown regulations. So as you've already heard, and you already know, as of the end of March and into April, it was illegal to leave home without a reasonable excuse, and social distancing was made a legal requirement. Two forms of social control became increasingly evident back in April. One was members of the public shouting at people breaking social distancing regulations to go home. And we can conceptualize this as an informal type of social control. So a do-it-yourself kind of thing that implies no recourse to official channels. Another form of social control that became increasingly evident in April was people calling the police to report those breaking social distancing regulations. So certainly during the initial stage of the lockdown, there was a large surge in those reports coming through to the police. I should probably make the point here that, of course, we don't think that either of these behaviors are necessarily ethically desirable behaviors, but it's still interesting and important to understand why people might engage in such activity. So what might have motivated people to engage in social control activity of this kind? We considered policing motivations for social control. So back in April, we had seen enhanced policing presence in our communities and on our streets when social distancing was made a legal requirement. At the time, as John noted in his talk just now, public compliance seems to have been remarkably widespread, and the police rarely had to intervene to enforce people to abide by the social distancing regulations. And indeed, polling results at the time suggested that people post-COVID-19 think a fair bit more positively about the police. So what psychological mechanism was underlying the public's positive attitude towards the police? Was it about thinking less in terms of me and more in terms of we when defining who they are? So more technically in terms of a shared police identity. In other words, what I'm trying to say is that might people be framing their social control activity through their relationship with the police? So the argument that social identification drives behavior is quite well rehearsed. We know from the social psychological literature that by defining who we are, norms define social groups and are especially powerful in driving behavior when people identify with a particular social group. We also know from the policing literature on motivators of public compliance and cooperation with the police that social identity matters when predicting cooperation and compliance specifically. So drawing on this well-established process model of procedural justice theory, we tested a pathway that predicts that fair treatment at the hands of the police expresses, communicates, and even generates feelings of belonging, inclusion, and status within salient social categories. In turn, a sense of shared group membership with the police engenders cooperation and compliance, in our case, in the form of social control of COVID-19 lockdown regulations. What else might have motivated readiness to engage in social control activity? So we tested police identification against another important identity in the COVID context, which we don't think has much to do with the police at all, and that's identification with the NHS. So the NHS, of course, have been at the forefront of the COVID response, especially back in April. Every day we heard on the news of our heroic NHS frontline workers battling the pandemic to save lives. In what became a weekly tradition, the nation came together every Thursday at 8 p.m. as part of the Clap for Our Carers campaign to applaud NHS workers at this unprecedented time. And rainbow posters, as many of you probably recall, that had become a symbol of support for those wishing to show solidarity with the NHS, had been displayed around the country. And indeed, polling results at the time suggested that people post-COVID-19 think a lot more positively about the NHS. So we expected identification with the NHS, or put more simply, solidarity with the NHS, to predict readiness to engage in social control activity, because the key message that the NHS was promoting was to work together to combat the virus. We also included one more plausible predictor of social control activity in this context for fairly obvious reasons, and that was trust in the government to deal with COVID-19. So The idea here is that if people trust that the government is doing a good job to deal with COVID, then they might be less likely to feel that they should be taking things into their own hands by engaging in social control activity. Or even on the flip side, they might be more likely to engage in social control activity because they support the law and the regulations put in place by the government. So what I've talked about so far can be distilled into one key research question, which in turn motivates the analysis that I'm going to share with you. In the early days of the lockdown, what was motivating people to engage in social control of COVID lockdown regulations? Were these policing motivators or other important motivators in the COVID context? So to examine empirically whether a shared NHS and/or police identity were underlying people's readiness to engage in social control, we drew on the first wave data from our multi-wave panel study. As you've already heard, this data was collected on the 21st of April, at the peak of the pandemic in the UK. So had people developed a shared identity with the NHS and with the police? The answer here is yes. So we asked people to rate their level of identification, both with the NHS and with the police. And as you can see in this table, people reported high levels of identification with both the authorities. So especially in response to feeling a sense of solidarity with NHS workers and the police. 63% of people said that they felt solidarity with the police, and 82% of people said that they felt solidarity with the NHS. This heightened identification with both the NHS and the police at the peak of the pandemic is not really surprising. So the search of a productive role in society, in the midst of being asked to do nothing, so stay at home, might very well be found in followership of those that are asked to do a lot. On this account, I think that the NHS and the police carry a heavy symbolic load. So linked to community and belonging, the NHS represent physical and mental well-being, whereas the police represent social order and safety. And echoing John's talk, we therefore suggest that this sense of shared identity has emerged A, by the very experience of a common threat, so the idea that we're all in this together, and B, by framing that threat in collective rather than personal terms. We were told to stay at home, protect the NHS, save lives. It was a collective effort. Were people self-reporting engagement in social control activity? The answer here is yes. So to measure social control, we asked participants this question. If you saw people breaking the rules on social distancing, for example, having a barbecue in a local park, how likely would you be to do the following? 1, shouted people to go home. 21% of our sample said fairly likely or very likely. And 2, call the police to report them. Here, 40% of our sample said fairly likely or very likely. So note that these aren't really low levels of engagement in social control activity, given that, for example, shouting at someone to go home is pretty confrontational. So here's the model that we tested. So we tested a model with the 2 forms of social control as 2 separate outcome variables. One outcome variable was the form of informal social control, so shout at people to go home, and the other one was call the police to report people. As shown in this figure on the slide, for each outcome variable, we tested A, whether a shared police identity explained variation in self-reported social control. And to do this, we specified a direct pathway from police identification to social control, as well as an indirect pathway from police procedural justice to social control via police identification. B, we tested whether a shared NHS identity explained variation in self-reported social control. And C, trust in the government to deal with COVID-19 was included as an additional exogenous predictor of social control. And we controlled for various participant characteristics in the model. So we controlled for age, ethnicity, and education. So what did we find? Did policing make a difference to people's social control behavior? We first turned to whether social identification with the police made a difference. And the answer here is yes. So we found that a shared police identity predicted social control of COVID-19 lockdown regulations, both the informal social control variable, shout at people to go home, and calling the police. In other words, those who said that they often called the police to report people breaking the rules on social distancing or shouted at them to go home felt a stronger sense of solidarity with the police compared to people who never did those things. And also in line with the policing literature, we found the indirect effects from procedural justice to both social control outcome variables via police identification to be significant. So what about the non-policing factors that we included in the model? Did social identification with the NHS make a difference to people's social control behavior? The answer here is no. So the NHS identity was not associated with either of these social control outcomes. In other words, those who felt a strong sense of solidarity with the NHS were no more likely to call the police, to report people breaking the rules on social distancing, or shout at them to go home, compared to those who felt a weaker sense of solidarity with the NHS. What about the other non-policing predictor that we included in the model? Trust in the government to deal with COVID. Did this make a difference to people's social control behavior? The answer here again is no. So trust in the government was not associated with either of the social control variables either. So the take-home message from my talk is that solidarity with the police, but not with the NHS, promoted social control of COVID-19 lockdown regulations back in April. We found that a shared police identity was conducive to high levels of self-reported social control. A shared NHS identity, on the other hand, and another important factor in the COVID context, and that was trust in the government, were not important when it came to social control of COVID lockdown regulations. It's really interesting that it's solidarity with the police that was important to social control activity and not solidarity with the NHS. I mean, one would have imagined that the strong sense of solidarity with the NHS that we did see in our data would have promoted social control of COVID-19 lockdown regulations as well. Because, like I said before, the NHS identity is all about working together to combat the virus. So once these other things were taken into account, so the NHS identity and feelings of trust in the government, policing specifically added to that mix. So despite this other stuff, things the police were doing were associated with these social control outcomes. And the fact that it's all about the police suggests that social control activity in relation to COVID is framed by members of the public through their relationship with police, which makes sense when you think about it, because shouting at someone is pretty confrontational. So you might want to believe that the police will assist and support you in doing so. So at the height of the pandemic, that was the picture. But what about now? We don't have the data to answer this question. Like John said, our study is over, but it's worth a speculation given the second lockdown commencing tomorrow in the UK. So regarding social control activity, in the period between the two lockdowns, members of the public were still calling the police to report the more obvious breaches to COVID restrictions, such as those relating to face coverings and groups of 6. And members of the public were still encouraged to do so by police forces across the country. Regarding feelings of solidarity with the authorities, well, according to our panel study, levels of identification with the police and with the NHS remained relatively stable over time. So from April until June, when we did include measures in our study. But will solidarity with the police continue? And will it continue to drive social control activity of lockdown regulations during the second lockdown, as we are once again advised to stay at home? Well, according to a report published by the Police Foundation 2 weeks ago, it appears that a heightened sensitivity to rule breaking over the last month, especially as depicted on the media, has fed into negative views of the police. So there appears to be an enforcement gap, whereby there are clear signs that the public wants to see the police enforcing the law more than they do to protect public health. So might the solidarity then with the police people felt back in the early days of the lockdown be fading? And if so, will the narrative behind social control activity switch from supporting the police to deal with COVID to, come on, we need to push the police to enforce more? Julia will be talking to you more about this when she talks to you about support for enhanced police powers during the COVID crisis. Thank you everyone for your attention.